Hi, we are going to do a bit of taping today, and I'm going to show you a few techniques that can actually alleviate pain up to 70% easily within one round of taping. This can be pain that's coming from the knee or around the knee. The idea of the taping is to move the joint into a position where if you have an open wound and you keep touching it, it's not going to allow the area to heal. So we are taping to move structure slightly away, to deload it so that it gives the area a chance to actually feel better, feel happier and heal. I'm going to share with you one or two of the easier ones to do at home, and then if those taping methods help, it's great. If it doesn't, do come in and have it checked out by a physiotherapist or your doctor. Before you tape your knee, first of all, if you're sensitive to hair being pulled, shave it. Secondly, you cannot be in a tense position, so your knee cannot be completely tense where your patella is not moving, everything is very stiff. You must make sure that the knee is slightly bent so that you can actually move and relax and move your patella freer. So it has to be able to move. The joint has to be able to move freely without much force. You get a bit of rigid tape. This is not kinesio tape, so this is one of those which do not have elastic properties. It's actually stiff. Whenever you want to tear rigid tape, always tear from the darker end to the whiter end. It's easier to tear if you just do the one pull. If you try the other way, you'll be struggling to do it a bit. So again, for pain at the bottom of the knee, what you can do is you can tape it. 90% of the time, this direction works. Going inwards. For some people, their inflammation or their area of pain can be on the opposite side. So what you need to do is you need to do a mirror image of going the other way. So I'm going to show the way that majority of patients have complained of. Okay. So what you do is you put an anchor first, then you use your fingers and you just push that area away from that position towards this direction, and you just pull slightly and tape it down with a slightly upward direction like that, shifting it this way and lifting it up slightly. Then you take another tape, same thing, similar thing, and put it here and pull it out again and paste it down. Okay, and you can do one more round just to enforce it. Okay, so again, this is for pain, for people who have pain at the bottom of the knee, mainly from the tendon or the fat pad or bursa area. Okay, and there. Okay, so you can either put additional tapes to lock it off, or you can leave it like this. It's a very simple tape. It just is what it's doing is just pulling a force in that direction and alleviating a bit of pain that's most of the time in the lower knee at this portion, and that will really help. If you have pain slightly above, you can do this also and include a bit of taping to your kneecap. So kneecap, again, you need to have a bit of give first, so your kneecap must be free to move. Go to your kneecap, push and tape it down, and that again will help to alleviate any pain which is on this side of the knee. And this should be more than enough to reduce a lot of pain that people feel over here.